Greetings and esteemed colleagues. I am Dr. Ashutosh Mishra from Cardiopcon Varanasi, and today we will delve into the crucial topic of diuretics in patients with chronic kidney disease, CKD. This presentation is based on a comprehensive review article published in Nature Reviews Nephrology on January 7, 2025 by Rajiv Agarwal, Ashish Verma, and Panayotis Georgianos. Understanding diuretics in CKD. Diuretic drugs play a vital role in managing patients with CKD. These medications target electrolyte transporters in the kidneys to induce diuresis, which is particularly important in CKD patients due to their reduced ability to excrete dietary sodium. Pathophysiology of sodium retention in CKD. In CKD, nephron loss leads to a deficit in sodium excretion capacity. This problem is further exacerbated by Q1, systemic activation of the renin-angiotensin-aldosterone system, RAS, 2 intrarenal RAS activation. These factors contribute to limited urinary sodium excretion, resulting in increased plasma volume. Consequences of sodium retention. If there's no compensatory decrease in systemic vascular resistance, the increased plasma volume can manifest as elevated systemic arterial blood pressure, volume overload management, strategies for sodium and volume overload. The primary approaches to managing sodium and volume overload in the CKD patients include 1. Dietary sodium restriction. Limiting sodium intake is crucial. 2. Diuretic therapy. Enhancing urinary sodium excretion through medication. Types of diuretics and their applications: thiazide and thiazide type diuretics. These are foundational therapies for hypertension management in CKD patients. Loop diuretics. Loop diuretics are often necessary for managing volume overload. In some cases, combination therapies may be required for optimal results. Mineralocorticoid receptor antagonists, MRAs. MRAs play a significant role in managing diuretic-resistant volume overload, treatment-resistant hypertension. Additional applications of diuretics in CKD. Diuretics have several other important uses in CKD patients. 1. Diagnosis of kidney diseases. 2. Management of electrolyte imbalances. Hyperkalemia or hypokalemia. Hyponatremia. Hypercalcemia, hypomagnesemia. Key principles in diuretic therapy for CKD patients: individualized treatment. It's crucial to tailor diuretic therapy to each patient's specific needs and CKD stage. This includes considering type of diuretic, dosage, administration, schedule, monitoring. Close monitoring is essential for safe and effective diuresis. This includes regular checks of electrolyte levels, kidney function, blood pressure, combination therapy. Optimizing blood pressure control and minimizing side effects can be achieved by combining diuretics with other antihypertensive drugs, implementing dietary sodium restrictions, managing diuretic resistance. In cases where monotherapy is ineffective, combining loop and thiazide diuretics can be beneficial. Patient education and empowerment. Successful treatment relies heavily on patient understanding and adherence. Key aspects include educating patients about their diuretic regimen, explaining potential side effects, emphasizing the importance of adherence. Simple tools can be provided to patients for self-monitoring. Automated sphygmomanometer for blood pressure monitoring. Regular weighing to detect potential volume overload. Conclusion. In conclusion, diuretics are a cornerstone in the management of CKD patients, addressing issues of sodium retention, volume overload, and hypertension. Their use requires a nuanced approach, considering the individual patient's needs, careful monitoring, and a combination of pharmacological and non-pharmacological strategies. By adhering to these principles, we can optimize the care of our CKD patients and improve their outcomes. Thank you for your attention. I will like to invite you all at CardiUpCon 25 Varanasi 6-7 Nunnal 8 March.